It's a good time. It's a good time to start the evening with a very, very important topic, because I think during the COVID times, access to healthcare has become very, very important, and a digital way of getting healthcare. Digital healthcare is also gone into very high importance due to the pandemic over the last 2.5 years. And who all probably get impacted by this kind of digital health program has been seen through telemedicine, which has quickly picked up, and the government rolled out the regulations very quickly on telemedicine, and which has enabled the healthcare delivery mechanism to reach out to the others corners, including remote areas, let alone the cities, where, of course, it has been almost a requirement considering COVID condition. So I think we are going to talk about a very important and a relevant topic today on digital healthcare access equality for all ages, because I think it's the geriatric population which needs a lot more care at this point of time. First thing which I saw in the newspaper today was our renowned singer Lata Mangeshkar getting admitted into the ICU because of her COVID and infection in her lungs. So I think it's people back at our homes, our parents, our grandparents who need a lot of care, and we need to learn a lot more about this. Without doing much ado, while the people continue to join in, we will kickstart the program, because we are aware that Dr. Madan Gopal has a short window of time with us. So I would like to kickstart the discussions by requesting the co-chair of our Hospitals and Diagnostics Committee, Dr. Sameer Gupta, to kindly give his formal welcome remarks. Over to you, Dr. Sameer.
Thank you so much, Vivekji. And I think this is a very important topic we're going to talk about today. So on behalf of the PHDCCI, I would like to welcome our guests on the webinar. Mr. K. Madan Gopalji, who's the Senior Consultant of Geriatric Care at the NITI Aayog. Welcome, sir. Mr. Rohit Kumar, who's the Chief Executive Officer of HelpAge India. I'd like to welcome you, sir. Dr. Ipsito Chakravarti, who's the Director of Geronto Technology Research Wing at the Calcutta Metropolitan Institute of Technology. Welcome, Doctor. I would like to thank all of you for sparing the time for this important topic. I would also like to welcome our co-chair of the Health Hospitals and Diagnostic Committee, Dr. Deep Goel, for his continued support in organizing various knowledge sharing sessions for the industry and public at large. The PhD Chamber of Commerce, and Industry, ladies and gentlemen, have been working as a catalyst for the promotion of Indian industry, trade, and entrepreneurship for the last 116 years. It is a forward-looking, proactive, and dynamic pan-India apex organization. As a partner in the progress with industry and the government, PHDCCI works at grassroots levels with strong national and international linkages for propelling progress, harmony, and integrated development of the Indian economy. Every person in every country in the world should have the opportunity to live a long and healthy life. And we know in this COVID time, this has become even more important, and it has become even more in your face. Yet the environments in which we live can favor health or be harmful to it. Environments are highly influential on our behavior and our exposure to health risks, for example, air pollution or violence, our access to services, for example, health and social care, and opportunities that aging brings. The number and proportion of people aged 60 years and older in the population is increasing. This is partly because of the increase in the healthcare infrastructure of people across the world, more so in India. In 2019, the number of people aged 60 years and older was 1 billion. This number will increase to 1.4 billion by 2030 and 2.1 billion by 2050. This increase is occurring at an unprecedented pace and will accelerate in the coming decades, particularly in developing countries. This historically significant change in global population requires adaptations to the way societies are structured across all sectors. For example, health and social care, transportation, housing, and urban planning. Working to make the world more age-friendly is an essential and urgent part of our changing demographics. COVID-19 is changing older people's behaviors and daily routines, the care and support they receive, their ability to stay socially connected, and how they are perceived. Older people are also being challenged by requirements to spend more time at home, lack of physical contact with other family members, friends, and colleagues, temporary cessation of employment, and other activities, and anxiety and fear of illness and death, their own and that of others. It is therefore important that we create opportunities to foster healthy aging during the pandemic. Digital equity is a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, demography, and as a society, democracy, and economy. Digital equity is necessary for civic and cultural participation, employment, lifelong learning, and access to essential services. In fact, the World Health Organization has underscored the need for digital technology uptake among all age groups, including older persons, to ensure new opportunities and benefits are available to everyone. On 1st October 2021, the United Nations declared the theme of this year's International Day for Older People as Digital Equity for All Ages, which predicates the need for access and meaningful participation in the digital world by older adults. Considering the growing age population and the socioeconomic support, PHDCCI has initiated the webinar series on healthy aging. And as a part of this digital technology, we have organized this webinar. Therefore, on behalf of PhD Chamber, I would like to welcome you all and seek your active participation on this discussion. Thank you.
Thank you, Dr. Samir, for those heartfelt, warm welcome remarks, and also stating out very clearly certain important facts which talk about the geriatric healthcare and the digital healthcare, which needs to be made accessible to them. May I now request Dr. K. Madan Gopal, advisor, senior consultant geriatric care at NITI Aayog, to kindly give his thoughts for the evening. Before that, I'd like to just read out 2 lines of his profile in the time constraint. Dr. K. Madan Gopal is a health professional with MBBS MD qualification and has been working on issues related to health systems reforms and strengthening in India for more than 28 years now. He has done his MBBS and MD and community medicine from GMC Bhopal, as well as his preventive and social medicine from GMC Bhopal. So may I now once again request Dr. Madan Gopal to kindly share his thoughts for the evening. Over to you, Dr. Gopal.
Thank you, Vivekji, and the esteemed colleagues sharing the panel with me. Vivekji, take care, because this is testing times for all of us. Yesterday, the cases were 194, and though the symptoms are mild, but we have to be taking caution, because the systems will be overwhelmed in the coming days as the pandemic is progressing. Please take care and be safe. So, as rightly pointed out by Samirji, that the world population is aging. That means in India, I will just share some data points. In India, in 1994, the population was 94.2 crores. We stood at around 136 crore in 2019. India recorded a life expectancy, improvement in life expectancy, which was 47 years in 1969, growing to 60 years in 94, 69 years in 2019. When the next census comes, it will be more than 70. That is expected. 86%, 8.6% population was of the age 60 and above, and it is projected to rise to around 12% by 2030 and 20% by 2050 as per the last report. 71% of the elderly, they reside in rural areas. Which proportion will change? We have been talking about the equity because most of the rural people, the productive age group, they come to the urban areas or they go into the productive life cycle, leaving behind the elderly population there to take and fend for themselves. This is an issue where we have to see that how we cater to that so that the equity aspect is also being addressed. Then life above 60 years runs the risk of being fraught with frailty, illness, mobility restrictions, social stigma, neglect, and abuse. With the brain disease are also increasing, the brain disease like Alzheimer's, dementia, they are also on the rise. You can think of the plight of the elderly people. The life expectancy is improved. People are migrating from rural areas to urban areas for livelihood, living behind their elderly. With dementia and Alzheimer's also showing an upward surge, you think about the problem. These were the few data points, but as rightly pointed out that during the COVID times, this telemedicines and telehealth, they have come as a boom. Once when the first wave started way back in the early March 2020, and after the exponential growth of daily cases, the lockdown was enforced so as to give the system chance for making preparations. During that time, you might have everybody can recall that what was the plight of doing a teleconsultation, WhatsApp consultation, telephonic messages. The honorable courts have taken cognizance of that. They had passed orders against the use of this electronic means for providing prescriptions and consultations. When the lockdown was enforced, most of the people who have aged, they aged and were having comorbid conditions. And the comorbid conditions, they require a constant follow-up. With many of the private institutions more or less closing down operations and the health institutions being converted into COVID care centers, there was a challenge to cater to the requirements of these people. Here comes the role that can't we have enabling guidelines which can at least legalize telemedicine and teleconsultation. This is the background I am giving so that people can appreciate why these guidelines suddenly came into the being. At that time, we had the opportunity because our member was incidentally the chairman of the board of governors of MCI during that time. Along with them, this telemedicine guidelines, with the help of the other stakeholders who were there, who have contributed to this, guidelines are evolved so that the care of this set of people who were comorbid, who required follow-up care, they can be at least counseled and they can be provided medicine and prescription can be generated to them. With this idea, it was rolled out, this telemedicine guideline. And now you have seen that in 1.5 years' time, in 2 years' time, how this telemedicine, telehealth and everything has now been internalized and institutionalized in many of the hospitals and the other places. Now we are having a e-Sanjeevani portal and there are many telemedicine platforms have also come. But if you look at the digital equity part, that has been rightly pointed out by the Vice President, saying that digital equity is very important because as I have mentioned in the data point that majority of the aged population, they live in rural areas with little access to the digital things like a smartphone or that kind of equipments. If you look at the way how the digital thing has revolutionized the loneliness of this elderly people. If you look at the Facebook and other things, now you will find that these elderly people, now they are having a login password. They have made an account on Facebook and other social medias, and they try to cope up with the pace with the younger generation is following. They don't want to be left behind that. So if you see that sometimes you will be receiving requests from very, very senior and elderly people. You might have said that kind of trend has already started, but that is true for the people who are living in the urban areas. But I am talking about the people who are in the rural sector. If you are talking about the digital equity, are these people literate enough to use digital equipments? You might have seen people having the latest mobile, but are they literate enough to use all the features of the mobile? I'm talking about the learned and the more educated class, not to talk about the seniors and the other people who are in the process of learning. We have to see that when we want to promote the digital equity among the seniors, we have to see that how the digital literacy can be taught to them, how we can orient them, how we can make them aware about the digital things which are available. These are the questions which we need to ask and find answers. There are no ready-made answers to that. We have to find an answer to an upcoming problem so that it can be addressed. Digital things are going to stay, telemedicine is going to stay, but how optimally we can utilize it? Who will make, I'm just asking that if a senior is there, who will make a call for the senior? Can't we have some digital equipments where the senior can just at least with a push of button, it can connect them to the call center. Now, currently they are dependent on dependent on somebody to make a call for them, to take their problems and cite their problems. The moment the senior they start picking up the telephone and directly talking to the helpline, that means that kind of empowerment and that kind of access we have been able to create. There are 3-4 things as the aging happens, though in few years I would be also in that category, but if you see the digital journey of the country, we have all the programs, information is collected. Suppose if you look at, I'm just talking to funnel the discussion. In the health, you are having many programs. One TV program, the other MCH programs. Individual information is collected by all the programs. And now all these programs are riding on an integrated health information platform. So that with one common identifier, you can have information pertaining to that person collected there. With the digital mission, national digital mission, now we are creating a digital ID for the health institution, the doctor, and as well as the individual, so that electronic health records can be generated, which can at least empower and at least the urban and the rural, the skewness of the information, digital information that can be addressed through electronic health records. Now, in our vision document 2035 also, we have said that in the coming years, you have to do the surveillance through the electronic health record, so that whatever events, whatever things are happening to that particular individual, that needs to be collected through this. That's one way we are trying to build a system. The other is, who are the users? The seniors, the other persons who have aged, how they will be able to access this? You have to create an environment surrounding that, so that these people come forward and they start using all these things. Unless we are able to orient these people, make them use of this kind of information which is available, our work is still in progress. There are 3-4 areas where we need to work. We have to create an environment before I close down. One is how to have a preventive and early interventions. How we can have a intervention which it has muted. Sorry, it got muted. How we can incentivize the preventive health? How we can see that there's a periodic screening can happen. When you are 30 to 50, you usually do periodic screening, because that is bundled with your insurance or with your organization. The moment the person retires, where is the wellness screening for them? Unless and until something goes wrong, they will not come to the hospital. Can't we have a preventive screening program for this section of people? Then the home and the community-based care. This is an upcoming area. The home care industry is growing as a compounded annual growth rate of 18 to 25% annually. How we can popularize this thing? Because in the coming years, as per if you look at how the health technology has evolved in Thailand, they have focused and most invested in the home care. Most of the care, most of the things happens near the home, in the home care settings. So we have to see that how the home care can be strengthened in the coming years. Then apart from that, as we are aging, we have to create an enabling environment for active lifestyle. We have to see that how to utilize the seniors or the aged people for at least providing advice for. But there are many concepts which are coming out. It's very in the limited time span. We can't be discussing and elaborating on each and every concept. There's a, we call that a silver. Our senior interns. That concept is also coming. It is getting popularized, and you see that how the seniors who want to be actively engaged in the day-to-day life after their retirement, they are doing some community service attached to some religious organization. They started doing community services. Wherever you find that, you see the expertise which they have earned during the expertise and the experience which they have earned during their this productive lifespan. You see like how much they are productive in managing the efforts of this. We have to utilize this kind of potential which is available in this kind of activities. I will stop here. Once again, thank you very much. It's very much a work in progress. I have to see that a lot of work is to be done to see that how the digital inequality is brought between this generation and the older generation. We have a lot of work to do in this direction. I stop here. Thank you very much for this opportunity. Thank you very much.
Thank you. Thank you very much, Dr. Madan Gopal. I think before I also talk about your points which you have raised, I must acknowledge the presence of Dr. Deep Goel, our co-chair of the Health Committee, as well as our Secretary General, Mr. Saurabh Sanyal, who is also kindly has made it convenient to join the webinar. Thank you very much, sirs, for being here. Dr. Gopal, I think you have raised some very pertinent points, and I must mention that Dr. Sameer Gupta himself is running a aged care home in Gurgaon, which is called by the name of Aurum. And we are also looking at in what way can we support the government on their initiatives, wherein you did mention in your speech about the private healthcare being involved in providing the elderly care also at the same time. We also recognize this fact that when you talked about seniors being engaged in various socio-economic activities, we had a discussion and a meeting with the Secretary, Ministry of Social Justice also, and he did aware us about these programs. So we truly appreciate the efforts of the government on this and will request you to keep us posted and involved as much for any of the policy decisions or policy making exercise or policy feedback exercise which you may want, specifically in the geriatric care which you are heading back at Niti Aayog.
Okay, thank you, Vivekji. Thank you very much. We have noted this thing and we will keep you posted and get you involved in whatever we are doing.
Thank you. Thank you so much. And Dr. Sameer Gupta wants to say something, I guess.
Yeah. I just wanted to say, I just want to applaud the efforts of Dr. Gopal, you and your team to have this forward-looking decision of the 2030 and 2030, the 2035 mission of yours. It's as we recently, I'm a doctor by profession. I'm an interventional cardiologist, and we've recently gotten to the senior care space with the senior care facility called Aurum in Gurgaon. And as we got into this, we started understanding this more. We got this concept from the US where I worked, and it was very prevalent over there. Senior care is a little bit more advanced than it is currently. And when we saw those things, we said, let's try and get it to India, and we got more involved in this in India. I think there is a lot of scope, and you've addressed, I think, all the challenges that they're facing. The financial challenges, the social challenges, the economic challenges. And I think this is under your leadership and under your guidance of you and your colleagues. I think we should be set as the population ages.
Okay.
So one last thing which I just wanted to mention is that if there can be some sort of healthcare for people above a certain age, like they have abroad, where they have Medicare is the example in America, where if you're above 65 years of age and you have worked and you've contributed, then the government provides you insurance for your old age people, as you age. The benefit of that, right now private insurances are there and Ayushman Bharat is there, but Ayushman Bharat caters to a very specific population, which is the EWS category, and private insurances may or may not cover the pre-existing illnesses, and then it becomes extremely complex. That would be a very high ask. It's something which involves a lot of financial burden also, because if you read some reports, they will say that the US economy will crumble because of Medicare, because of the financial stress that thing is bringing on. There is something to consider, and if we can in due course try and bring something like that out. Just a thought, sir, and I know you guys are already looking into these.
No, Sunny, we are very much aware about this fact, and we are trying to see that how we address this thing. Right now, there is no ready-made answer. That's why I was saying it's all work in progress. We are trying to catalyze the senior care reforms, because the Ministry of Social Justice is doing something, Ministry of Health is doing something, Women and Child, they are doing something, and the Ayush Department is also doing, and Finance, the Department of Financial Services, they are also doing something. They're trying to see that which of the ministry would be the nodal for driving all this thing, and so that a nodal department is there for the senior care.
Yeah.
We are more or less reaching a consensus that which kind of department would be leading this thing. But it is evolving. As the things are evolving, we have to see that the financial inclusion protection would be taken care by DFS. As you have rightly mentioned, that the insurance companies, they do adverse selection bias for the senior people. Even the group insurance products which are available, if you see that the moment the age increases, the premium also increases. It should be the vice versa, because during the younger age, he is giving more premium. As he is growing, when his paying capacity reduces, he is not earning. He might be in pension. 90% of the people don't have pension in the country.
Yeah.
And you are asking premium, that too on a higher side, from where he will be making this premium payment. These are the questions which you need to answer. Otherwise, for the insurance, for the business purpose, it's okay. For a welfare measure, we have to go beyond that. And we are very much aware about this fact that this adverse selection is there. We will be taking up this issue. We are already, one vertical is already working, and we have to see that how it functions. Okay. These are all things which are evolving. We will be discussing offline with your colleagues and everything. Okay, how we do that. Excellent. So I have to take a leave now and see that.
Thank you, sir.
Okay, thank you very much, Vivekji and others, for this opportunity. Sorry.
Thank you, sir.
Thank you so much yet again for making it.
Thank you.
So taking the proceedings forward, I think very encouraging remarks and from Dr. Madan Gopal to involve all stakeholders in discussions being taken forward. I'd like to hand over this session to Dr. Sameer Gupta, because we have the likes of Shri Rohit Prasad and of course Dr. Ipsito and Dr. Deep Goel, who may be coming in and coming out because he's busy at the hospital also at the same time, to take the discussions on this particular topic forward. We know HelpAge has done a lot of good work, and I think it's a very respected organization when it comes to elderly care. So I'm sure we'll learn a lot of things from Shri Rohit Prasad, and of course from Dr. Ipsito during the ongoing discussions. So may I hand over the session to Dr. Sameer Gupta.
Yeah, good afternoon, Vivek. I'll take just a minute. Firstly, to say good afternoon to all the eminent panelists who are here, including Dr. Sameer Gupta, Shri Rohit Prasad, Dr. Chakravarti, and Dr. Deep Goel, as also in absentia our Niti Aayog Dr. Saab, who left just now. I'm sorry I could not attend it earlier because we had back-to-back meetings with the CIM, Honorable CIM, on the industry issues, and thereafter on the issue of steel, which was a separate one-to-one meeting with the virtual meeting with the CIM just now, which ended just now. So the president was also there. I believe president would have also not been able to join this. But this is a very, very critical point which I want to make, that the senior healthcare is becoming an issue day by day. And digital intervention is very much there. However, the senior citizens above the age of 80, they are unable to access any kind of medical healthcare. So deliberations may also be done as to how to overcome that. There are teams which I am told they work through the senior citizens' houses. There are various corporate groups or various teams which provide this sort of a healthcare, who come to the houses and they provide all the critical care, including helping them out in their day-to-day course, like banking system, the banking facilities, the medicinal facilities. There are people who, there are nurses who provide 24/7 care, but a person has to spend for it. And there are many persons, like it was brought out by the honorable chief guest who was there from the Niti Aayog. He also said that 90% of the people are non-pensioners. People are very lucky who are in the government service, who get pensions late, and their pensions keep on increasing to offset the market dearness. The escalation and the market escalation is taken care of it. But there are more than 90% of the people in our country who do not have this kind of facility. So what should be done by them? That is where we must deliberate. Dr. Samir is providing a human service to the state of Delhi and NCR, and also to the by setting an example of this Aurum senior living. There are many other people also, there are many other organizations also who are doing the same. So we would like to hear on that, what should be the road ahead, so that we can take up the cause with the Ministry of Health, as to this is what is required for the very senior citizens who are of the age of 75 and above, or say 80 and above. Thank you.
Thank you very much, SG. Thank you so much for your inputs. Very valuable, and I'm sure the discussions which will go forward will also focus on these. Over to you, Dr. Samir. I think there is a connection problem at Dr. Samir's end. Yeah, Dr. Samir, you're back.
Yeah, sorry, sorry, there was some internet issue.
Yes.
But yes, I'm back, and I think the SG plays some very important points about, and even when you age, it's like when you look at children, you divide the age group of a child, right? There's the infant up to a year, then there is 1 year to 5 years, there's 5 years to 10 years, and then there are teenagers. So similarly, when you look at older people, there's an age group from 60 to 70 when you've just retired, or 60 to 65 when you just retired, and for the most part you're just getting settled into your retired health. And then there is 65 to 70, and then 70 to 75, and 75 to 80. And each of these, if you were to divide it in these 5-year age groups, brings with it a separate challenge and a separate need, which is different from what it was before. For example, a person who's above 80 years old may not be comfortable living by himself completely, and his children may or may not be with him. As compared to somebody who's 60, who's otherwise just retired, he may be willing and acceptable to staying by himself. So I think there's some very important and valuable points, and I would love to hear what everybody else has to say about digital equity and equality. Without further ado, let me invite, I don't think Dr. Goel is here yet, so I'll invite Dr. Ipsito Chakravarti, who's the Director of Gastroenterology of Gerotechnology. I'm sorry, Dr. Chakravarti is the Director of Gerotechnology Research Wing at the Calcutta Metropolitan Institute of Gerontology. Dr. Chakravarti, I would like to welcome you. And I'll just give you a quick brief about him. He has been working on healthy aging agenda for quite a while, and he and his team have already got some valuable insights into the issue of primordial importance, and is striving towards a significant breakthrough in the multidisciplinary research agenda for gerontology and digital education for the elderly. Dr. Chakrabarti has received his formal training in this newly evolving domain from the UK, along with postgraduate and master's degree in mobile forensics from the University of Brunel and mobile computing from the University of Glamorgan in Wales. So, Dr. Chakrabarti, I would like to welcome you and would like to hear your thoughts. And I think we were all anxiously would like to hear your thoughts.
We have Dr. Deep Goel also, who's joined us. I think, thank you, Dr. Goel, for joining us. We know you've been in and out of the medical services back at the hospital. Thank you yet again. Dr. Ipsito, over to you.
Namaskaram. It's always good to begin with some conventions, although I don't like it. I'm running a fair bit of temperature, but I'll try not to slow things down. Anyways, on behalf of our organization, Calcutta Institute of Gerontology, Chakrabarti, and on behalf of myself and my research team, Genome Technology Research Division, also from CMIG, I'd like to express our deepest gratitude and heartfelt thanks to all of the PHDCCI members for inviting me over, giving me the opportunity to share, to interact, and to augment our understanding, or fundamental understanding of a subject which has already been deemed by senior officials of WHO to be the, what should I say, the be-all and end-all of gerontological research. The subject is healthy aging. Just excuse me for a couple of seconds. I'd like an artistic piece to begin with. Would you please share the presentation? Just a couple of seconds. Being an Indian citizen, a citizen of a nation which has already been hailed by all nations of the world to be the motherland of spirituality, the abode of philosophy, we have a natural tendency, a natural propensity, or should I say a psychological gravity to approach any problem from the philosophical vantage point. An objection readily comes to the mind: is philosophy any good in dealing with matters of everyday life? They are complex, they are non-linear. What can philosophy do? See, myself, I'm a technocrat. I'm a protagonist of mathematical research, quantitative research. Should I have to take resort in metaphysics and philosophy to approach a problem? It's highly unlikely. Then again, this unlikelihood is the very essence of human life. Suppose if I knew that what will happen tomorrow, I will have no impetus left in me to do any creative work today, because I know the result, I know the outcome. As Young said, this probabilistic field, this uncertainty, this is the elan vital of human life.
Dr. Chakrabarti, one quick thing. Are you moving your slides?
Yeah, I am.
We can't see that.
You can see the
slides are static. In case we can see your shared slides, but it's not going in a slideshow pattern.
It's not in a slideshow pattern?
No. We're on the slide of Om.
I'll restart it.
Yes. Now we're able to see it.
Is it okay now?
Yeah. So you may want to press the slideshow button in the bottom and then go slide to slide.
Yeah, we have pressed the slideshow button. Now is it visible?
It's you'll have to go. I think you'll have to choose the slides from the left if you're doing it this way, or in the bottom, the fourth thing in the bottom. I don't know how to.
Which is next to the percentage icon.
Yeah, which is next to the percentage icon.
Okay.
In the meanwhile, Dr. Samir, would you like to invite Rohit Saad to speak?
I think he is. I think Mr. Segal, he's just, or Dr. Chakrabarti, if you want to just go manually slide by slide on the left.
Okay, I'll go to manually.
Yeah. You have to click on each slide. Yes.
Is it okay now? Is it okay?
Yes. Yes.
So what I was saying that if there is no probability, no uncertainty, there will be no creative work left. We means myself and my research team, genome technology research team, approached this subject of healthy aging from the vantage point of philosophy itself. We used abstraction, we used fuzzy inference, and at last we came up with something which I feel is a lumen, the very core of healthy aging. I have tried to compress it and express it in 3 different sentences only. I would beg your attention resources right here so that we might not miss the mark. Here's how it goes. The first sentence: it is not the lifespan but the health span that matters. The second one: it is not the quality of life but the quality of experience of life that matters. See where I'm going? The last one: it is not the object but the subject that matters. So being equipped with this paradigm shift in scientific discourse, a shift from objectivity to subjectivity, that we finally saw the gates of that elusive wonderland of health and vitality in old age. The gates are opening slowly. And the light that was beyond human cognition, human perception, hitherto hidden from us, finally shimmered its way through the gates and beckoning us to bask in its divine radiance. With this, we have orientation enough to delve right into the subject without any further ado. Let's see. I have a quotation right here. Young uses so simple parables, so simple yet so poignant in nature, isn't it? I think that any deliberation on healthy aging, should have a central theme like this. What is healthy aging? How does technology or how does digital equity relate to it? What is the relationship between them, and how and what interventions might we plan? See, the first time in the evolutionary juncture, now we can claim that we are standing atop the loftiest summit of human progress. All that we need now is a synergistic action. Get together, share our subjective perspectives on healthy aging with each other to complete the circle of knowledge, and then start building a coalition, an integrated platform of multiple stakeholders from which we can swing into action, right? Bear in mind this ancient Indian tradition, ceremonial orientation of Agnodhya, lighting the candle. We will proceed with the topics one after the other, okay? As simple as it can be get. I have prepared this sort of animation. The animation is not showing. To get to the idea of healthy aging, see, it is a continuum. Continuity is a basic facet of healthy aging. The origin of continuum lies in healthy aging, the process itself. And as we proceed, we will come across different phases, different sub-phases, domains and subdomains, which are all rooted in the continuum itself. These are not discrete, nor they are separate, they are continuous. One such domain is digital equity for all ages, another is equity and accessibility to digital healthcare services. Try to approach this concept of healthy aging from 3 different perspectives. So you will realize these are not entirely different, they are all part of the continuum itself. Healthy aging as an order, healthy aging as just a literary term, healthy aging in the context of health. Okay, let's come to it one by one. But before we delve deeper into it, I think a very brief amount of background orientation is necessary for conceptual clarity. See, purpose and meaning. We seldom use these terms in our everyday life without coming to consensus as to what they actually mean. On the surface, they seem very abstract, isn't it? That abstraction has also been incorporated in mainstream science. See, duality is in the core of our existence. What is it? We are a human being. Okay, we are a human being on its way of becoming. See, this duality, being is static, becoming is dynamic. And as this great sage, Ramana Maharshi has expressed this nature of duality so elegantly, so beautifully. Being human beings, we have a choice. We always have a choice. Whichever we can select, we can choose to be the being, not do anything. We can choose any way of becoming. Whatever I feel that I'm passionate about this subject, I'm passionate about doing this, I always wanted to do this, I take it up. That becomes my purpose. That becomes my purpose. Okay. When I have the means to live out my purpose to the fullest, I get a meaning of life. Just see that formal definition of WHO, healthy aging, has been defined by WHO as such. See the ability to be and to do what the individual deems valuable. If I deem something valuable, I take it up, it becomes my purpose. If I have the ability, this functional ability to live out my purpose, live to the fullest in my life, I get a meaning. I get a meaning in life. And if this ability, this functional ability is sustained, then I am living a healthy aging. It's simple. So I was coming at this one, this quote. If it is a quote, what does a quote tell us? It's very simple. Find your purpose. Live out the purpose to find a meaning. This is what we can get to if we try to understand healthy aging as a quote. It's that simple. The next perspective, not that simple, but I'll try to make it so. As a linguistic variable, a literary term, healthy aging. See, thus far, all the aging phenotypes like active aging, successful aging, productive aging, we have understood them as binary paradigm: successful, unsuccessful, active, passive, right? But this is not the way human life plays out. First time, healthy aging is bringing to us this notion of continuity, this notion of inclusiveness. When I say that healthy aging is a spectrum or a continuum, in mathematical parlance, we can visualize it as a set. Healthy aging, HA, let it be a set, okay? I have chosen 5 phenotypes of aging as 5 members of that set: successful aging, productive, active, sedentary, and atypical. That is pathological aging. Mu is the membership function. What does that mean? Mu of successful aging equal to 0.84. That means the degree to which successful aging belongs to healthy aging, the degree to which productive aging belongs to healthy aging, and so on and so forth. See, successful aging and healthy aging are conceptually very, very similar. So of course, mu of alpha, that is successful aging, will be the highest, 0.84. We will say that successful aging belongs to healthy aging to the degree 84%. Productive aging belongs to healthy aging to the degree 43%, and so on. So it's a degree of belongingness, how far, how much I belong, how much each member belongs to the set itself. It is a continuum. This is a more scientific one, the context of health. Years ago, WHO has defined health. It is not an absence of disease. It is a state of physical, mental, psychological, spiritual vitality. Now, what do I mean by vitality? See, if I were to fly off to USA today, my biological clock will change, my circadian rhythm will get hampered, okay? I will suffer what is called jet lag for a few days. I will take a few days time to return back to my normal state of vitality. What does that mean? I'm taking time to cope with my environment, to adapt with my environment. So if I am perfectly in sync with my environment, I am vital, I am healthy, right? Otherwise, I am not. It is this state of organism environment congruence, person environment fit, being poised at this level of adaptation. This is the vanguard of health, vanguard of vitality. See, when nature and nurture becomes one, when we finally realize the communion between nature and nurture, between subject and object, it is at that point of time that we realize that beneath the multiplicity of singular elements, there lies a unity of an organic being, as proposed by Professor Frederick McMullen. So this is the case. What wrong is there? What is happening? City was supposed to be the panacea for all ages, right? Solve all human problems. So why elder adults are lagging behind? why are they getting more and more out of this changing digital environment? When I say environment, see more and more amenities, more and more services now being hosted online, available in the cloud. That means our classical environment is getting progressively hijacked by the virtual environment. This changing environment, I need certain degree of adaptability to adapt. We all know that with age, this potency of coping, adaptation decreases, falls off. So what about digital literacy? Why not plan some digital literacy campaigns to empower the senior citizens with this, how to navigate the digital landscape? They are not producing expected results. Why? Till date, there is no single smartphone for elderly in the market. No sustainable such products are there. Why? Again, why? Because we are not trying to delve into the root of the matter, the problem, that the kernel of the matter. What is the kernel? See, it starts from here. This is what the senior citizens are familiar with, learning from a book. How do we learn from a book? We read from left to right, from top to bottom, finish the page, turn it over, do it once again. This is linear navigation. Now, all of a sudden, the book is gone. The book is gone, and there pops up a web page of some reputed website. So many information in terms of hyperlinks, so many information all scattered all throughout the screen. Not linear, highly non-linear. This requires a different type of skill, not linear navigation, but branching navigation. Bear in mind, a different type of skill. As we all know, acquiring a new skill set becomes difficult with age. There are no sustainable elderly-friendly interface or smartphones. Why? Suppose I am an R&D designer. Okay, I'm trying to design an age-friendly interface. By my expertise, by my experience, I have designed one such interface. I feel this is the age-friendly interface. Suddenly, a senior citizen comes on. He says, no, this is not what we want. So I will go by him or by my experience and my expertise. I should go by him because the thing is meant for him. That is where we are lagging behind. We are not taking direct feedback from the elderly themselves, how to fine-tune the environment, how to create these age-friendly interfaces. See, in italics, user-centered participatory research. That means most of the respondents of this research are researchers themselves, and vice versa. That is the call for the day, the need of the day. We must consult in every aspect before we start planning an intervention paradigm. Our research team has come up with a few suggestions. These are suggested measures. If we want to design an age-friendly interface, if we want to carry out digital literacy campaigns, I think these should be borne in mind. Maximize linearity, reduce branching, keep it short and simple, the CRISP principle. Introduce the drag effect. What is the drag effect? Instead of crunching too much information in one page, distribute it evenly in 5 consecutive pages. It will be easier for them, for older adults, to internalize. And then, of course, the most desirable, the most sophisticated intervention paradigm, that voice recognition interface in regional language. I've dug something up from the net. Here it is. This is the ultimate design of digital devices. See, just rub it, Genie comes out and works at your voice command. The way artificial intelligence is evolving, the way it is progressing, this might not be too far off, right? We're standing on the doorstep of artificial general intelligence. Our team back in CMIG, we are trying to design this software package. We have named it DHSSH, Digital Healthcare Services Smart Health. What is it? It has got 2 components, primary components. One is a database, an elaborate database of citing all healthcare service options that can be availed online. And then again, a smart assistant, similar to a chatbot, which will assist the user step by step to avail any of these healthcare packages. So till that is done and hosted in the cloud, I would request, I would suggest all pertinent stakeholders, geriatric stakeholders, to design a manual, digital healthcare service guidance manual, and distribute them among the retired welfare associations, senior citizen forums of respective state. I'll keep this intervention design for the question answer session. We have already devised a digital literacy model, which gives the purpose, the meaning, and also promotes more and more participation. See the advanced level trainees, elderly population who have done the advanced level training. They're going back to the beginning of the loop and leaping out this concept of elders for elders. And they're also sitting down with the system designers, with the vendors, and give them direct feedback as to how to create age-friendly interfaces. Then only it will be possible. Meaning, purpose, and participation. Nothing else. So what might be the takeaway, the primary takeaway from this webinar? Once again, I will not deviate from my viewpoint. It is all about helping them in finding a purpose. Purpose is subjective. We have not come to the world with any God-given purpose. It is subjective. I pick up anything as my purpose of life. If I can live it, I get a meaning in life. More and more participation, user-centered participatory research. Do not try to frame or design any intervention model without involving the elderly themselves in course of the preparation. It must be self-sustaining, like a human brain. It's a cybernetic system. It's self-learning, self-organizing, but it needs to fire only once, the startup phase. We need to start the model, start the intervention model, and then it will go on in iterative phases, repeat itself over and over again. Okay. See, any project, be it a project on AI, be it a project on geron technology, project on gerontology, it always starts with the initial documentation of what we already have, what resources, what inputs we already have. And we must clearly chalk out the outcome. What output do we desire? Then only we can proceed. Why I showed you this? Because, see, Ministry of Social Justice and Empowerment has already designed these intervention paradigms. Sacred, Elderline, Tapos, podcast. The onus is on us. The responsibility is on us to promote mass awareness of these resources so that senior citizens all throughout the nation, they might have a clear idea about what they have already and what they don't have. It's very clear. This is where all logic ends, all science comes to a halt. We need grandparents, okay? Why do we need grandparents? I don't care. We don't want to know the answer. We just need grandparents. It is a matter of human heart. A human heart is not linear. Heart speaks unto heart in the language of love, right? And spirit speaks unto spirit in silence. I've always felt that this life is like a kaleidoscope, right? One moment it is an unfathomable mess of different hues, different colors. Shake it, withdraw, shake it, and then look at it again. It becomes a beautiful rainbow. So I think before this transitory life ends and it's time to shed off our mortal tenements, let us leave a mark. Let us unite, form a coalition, kind of humanity has never seen before. Let us proceed for that coalition itself. So what we are doing, we are just working and praying. We work and we pray with this unwavering faith. The divine grace will be showered on us. It will be showered on us in due time, fulfilling our lives, fulfilling our mission, our vision, here and hereafter. Thank you. Stop sharing. Just a second. Okay.
Thank you, Mr. Chakrabarti. Dr. Chakrabarti, I think this was a very enlightening speech, both not just the content, but also spiritually, it was very enlightening. I think that's a very important point. I really like the way you divided the aging, successful aging, productive aging, active aging, sedentary aging, and atypical aging. And I think this was very, very unique, and it really gave a new perspective on aging than what you normally think. I think you raised some very other important points, like keeping the elderly involved in technology, when you're making the solutions for technology for them, involve them. And I know you've done some work on it, and you showed a slide which you kind of skipped, and you said you will talk about it later. I think that slide was very important.
I want to share it with all.
And also, I'm sorry, what?
Yeah, I want to share the slide with all, that model. I want to share, if it is possible at all.
Yes, please. Yes, please. But we would love to hear that. But I think for the sake of time, the constraint of time, I think we should move on to the next speaker, Mr. Vivek. I think we're running short on time. So without further ado, I'd like to invite Shri Rohit Prasad ji. Rohit Prasad ji is a very well-known person in the elderly care space. He's the CEO of HelpAge India, which is kind of a very popular organization for older adults. He was associated with the Public Health Foundation of India as a director for developing and strategic initiatives till 2016. And to give you a little bit more about his background, he's done most of his education in Delhi. He did his economics from the Shriram College of Commerce, and went on to do his business school in business administration and marketing and finance from FMS University of Delhi. And he did a strategic non-profit management and social enterprise education from the Harvard Business School Executive Education Program. So Dr. Prasad, we are all excited to hear what you have to say about the digital equality, especially towards the senior citizens. Thank you and welcome.
Thank you, Dr. Samir Gupta, for that very kind introduction. Good evening to all participants who are there in this webinar, and to my fellow panelists. I would very much like to start by complimenting PHDCCI for taking up this very important topic. It's very relevant. It is something that was relevant before the pandemic, but of course is becoming even more relevant. So I'd just like to, a lot has already been covered, and very important points have come up. And I would just like to build upon that. So I have a presentation which I like to walk through. Can everybody see the presentation?
Yes, sir.
Yeah, okay, good. So essentially, basically I wanted to, this is a very multidimensional topic, as you know, and it's a very complex topic, but very multidimensional as well. So we are talking about healthy aging, which is of course the big mega trend and very important across the world, but also digital, which is the technology aspect. But more importantly, I think also the equality aspect. And that's why I wanted to compliment you for covering this topic in all its dimensions. So I wanted to take everybody across three areas. One is the aging context, and of course the implication on not just health, but also on the care side, which is very relevant in the aging context. The digital health, which is a big opportunity, but it is also a big divide, and some elements of that have been mentioned here. And on the few pointers on way forward as we see it. But before we do that, I just wanted to give a quick glimpse of the organization I represent, HelpAge. Many of you may be aware. It's one of the organizations working on elder care for a very long time. We are present across the country. We partner with many organizations, corporates on their CSR programs. We reach roughly about 20 lakh directly through our programs in healthcare, aged care, livelihoods. We were fortunate to win the award by the UN, which is the only organization, NGO in the world to win this on the aspect of population. Our mission is, of course, we are focused on the care, cause and care of the elderly, but particularly the disadvantaged older persons, which is a very significant section of the society right now. We envision a society where the elderly have a right to an active, healthy, and dignified life. Four main important areas: healthcare, aged care, livelihoods, awareness, and advocacy, present across the country. Mobile health units is a very important part of what we do. It's reaching the unreached. We also run the helpline. Dr. Ipsito mentioned about the Elder Helpline, which is initiated by the Ministry of Social Justice on 14567 as the national helpline. We are fortunate to be running it in 6 states. We are part of the elder self-help groups that we have set up on the lines of the women self-help groups. So overall, we have a broad range of work we do. But what do we believe in? And that's what very important. And Dr. Ipsito gave a very fascinating presentation outlining some of the more philosophical underpinnings of the work in aging and health. So I like this quote by Nelson Mandela very much, which says that, a society that does not value its older people denies its roots and endangers its future. So let us strive to enhance their capacity to support themselves. Very important, to enhance the capacity to support themselves for as long as possible. And when they cannot do so, then take care of them. I think that's a very important philosophical underpinning to how aging is approached. We would like very much, we believe in and would like very much to change the aging frame. There's a lot of negative frame to it, but how do we change it to a positive frame? And the Ministry of Justice and other have been doing some very important work here. But also about, it's an all of society effort. 10% of the population is older person right now, but 90%, and those 90% will reach the 10%. So it's all of society effort. And also about how to make an age-friendly environment. This is, of course, all these underpinnings are very much there in the overall approaches that the world follows. SDGs, leave no one behind, including our own Sarvodaya through Antodaya, which is the reaching the furthest behind first. And these are very important aspects that are kind of builds the foundations on how we look at aging, and therefore how do we transform aging into something much more positive. So looking at from a health and care imperatives, and one of the points I wanted to share, and this is something that many of you would know, the multiple determinants aspect of it, because it's not a single element that decides the aging and health and care. But one of the very important trends right now is how, it's a very positive trend that because of the improvement in health, aging or the lifespan has improved. And we know that people are living longer, but the lifespan versus health span is a very important frame. But everyone who is at 60 can live up to another 20 years up to 80. That's the basic point. So 1/4 of somebody's life is leading from age 60 to 80. How will that person live that life is a very important fundamental question that is, so we focus on the early years, mid years, but we don't focus as much on the latter part of life. The life course approach to aging is a very interesting frame by WHO, which talks about what happens post 60 is also dependent upon what happens pre-60. And they talk about how the intrinsic capacity of the individual falls. And it's a very natural aging phenomena. So some of the attributes may go down. But the functional ability, and Dr. Ipsito referred to this, is the ability to perform things that one values. That also goes down. But if we are able to, over the period of time, build this intrinsic capacity, then my functional ability will improve. And that's a very important point from a digital perspective, which I'll come back later. There's a lot of policy context around it. I just listed some of them, so I won't go through those. But the key point being that the intrinsic capacity and the functional ability, if we work on it over the years, then the latter part of the life can become far more meaningful. This, of course, also correlates to the long-term care and the health services. And Dr. Gupta mentioned about some of the aspects around how assisted living and care for living is happening. But there's also the whole long-term care. Where does it happen? Does it happen in institutions, or does it happen in family? And that's a broader approach that any society has to take. And the environment in which you live in. Again, health is it's something which is more broader than just the physical health, and WHO has emphasized this. Dr. Ipsito also covered this. The aspect around multiple determinants is very relevant, because it's not just the health from a medical perspective, but from a broader perspective is what ultimately decides the health. And there are various aspects around housing, assistive technologies, transport. All these make a difference, and therefore the decade of healthy aging, which WHO announced, is focusing also on many of these aspects. So health, we would like every elderly, everybody who ages, who's lucky to age, be safe, relevant, happy, secure, engaged, active. But for many of these things, the health is a very fundamental determinant of that. And therefore, how do all these linkages happen is an important question. So coming to the Indian context, 10 crores in 2011, 14 crores right now, 30 crores by 2050. It's one of the fastest growing, segments in the society. But what's particularly important is that while most countries took 50 to 100 years to move from a 7% population elderly to a 14%, India will do it in literally 30 years. So much shorter time to respond to these changes just because of the demographic curve or the trajectory that we have. So what is the status of elderly right now? And you would find that there's a 14 crore population, 140 million, but 50% of them live below the poverty line. And Dr. Madan Gopal rightly attributed to the fact that they were affected one of the most. People leave their rural areas, move to the urban areas, and many of them, because of the lack of social security, are left poor. 90% in the unorganized sector, 60% suffer from health problems, nothing new, we know that. But there's also a feminization of aging. A lot of women, because of the longer lifespan as well as the early marriage, they sometimes are left single and living alone. You'll also be surprised that the elder abuse in the country is going up, which is again an aspect of health because it's a mental health issue. So overall, you would find that the elderly risk being left behind, invisible, and last in the lost. During the pandemic, this of course became much more severe, and we came out with a report. We titled it purposefully Silent Tormentor because in COVID-19 in many ways was affecting the elderly in multiple ways. But one of the most important aspects from the survey came was that 78% faced access issues. They could not access the services. Rest of the world moved on. There's a digital option, but they were left struggling. 65% faced loss in income because either they were not able to work, and most of them have to work to survive, and 61% felt confined and excluded. So the technology options were there, but they were not able to access it because the cash transfer to the bank was there, but they did not have the digital money. Telehealth consultations was there, but they were not able to access it. So the aspect about that, and I think some gentlemen mentioned about it, that it's no longer a nice to have. It's a key requirement. If you have to survive, live, grow, then the technology is a key requirement. So the urgency of moving fast on this is very much there. We also asked this question, what all challenges did you face during the pandemic? And you'll be surprised, maybe not surprised because everybody has experienced it. A lot of the mental health issues came forward, depression, anxiety, and of course the anxiety also related to just accessing basic services, groceries, cooking, utility bills. How do you pay all this? And this led to a lot of anxiety amongst the senior citizens. So the digital imperative, I don't want to dwell too much on it because earlier panelists have covered it, but the case that the digital can be transformational is a given. And that's something that has been highlighted by the Ministry of Health through its National Digital Health Mission. Dr. Madan Gopal was referring to this. It's also a very large landscape. There's mobile health, therapeutics, technology, sensors, wearables. But for the elderly, there are few areas which are becoming very pertinent. And Dr. Gupta mentioned about some of them, which is the home care part he talked about. The primary health, telehealth is of course the most relevant. The NCDs, the remote care is becoming very important because there are people living away from the family or from the elderly. So they're very concerned about them, but they may not be able to take care of them. So if there's a way for technology to bridge that gap, then it becomes very relevant. But all this has to integrate with the age-friendly environment. And I'd like to mention the eSanjeevani OPD platform that the government ministry is running. And Mr. Prime Minister mentioned about the fact that telemedicine needs to be upskilled during the third wave, because that could be the option as an option for care to continue. So what is the way ahead for bridging this digital divide? And I just wanted to highlight 3 areas for everybody to consider. One is, of course, enhancing the digital literacy skills of the elderly. I mean, that is absolutely out of line with whatever the requirement is or whatever it should be. So how do you go about doing that? I mean, is it an option for the government to prioritize digital literacy for senior citizens? In our budget submission, we have made a case for a special initiative on this. But it's also about intergenerational, and it's also about the government, the industry, and the family coming together to make this happen. In some areas, for example, the rural areas, it's not about literacy per se, but how do you grant them access? And the common service centers was one example that we are working with NSC Foundation right now on digital for rural elders. So they may not be able to use the smartphone, but if they are able to access our local point, just like we used to do the telephone booth, STD booth concept. So you have the SCSC booth, and they can, through those terminals, access all the necessary services. We run a very large digital literacy workshop for urban elders. Dr. Ipsito mentioned about some areas that it can be improved on, and I think these are very relevant points, but it needs to be done. But why is it not happening? And so we did this survey, and it came out that who teaches senior citizens, how do they learn about it? So of course, the family members play different roles, but there was also a reason why they're not using the digital devices. And from our own experience, we would know that senior citizens have a different way of learning. Some of them need more patient teaching, and some children don't have time, or they don't want to be dependent on. But for various reasons, it's not adequately happening at home, which should happen, but it's not adequately happening at home. So there is a greater impetus or push needed for the society to ensure that senior citizens rise up the digital literacy curve. It can have a transformational impact on their lives. We have seen this happening in many of our work. They become empowered, better relationships, improved intergenerational bonding. They're able to access not only just health, but banking, entertainment, and other utility applications, which again affect their health. The second point I wanted to share is the aspect about innovating designing for elderly. And Dr. Ipsito very clearly and very elusively made that point that you have to design for the elderly. You cannot impose certain things which are available for elderly to use. It doesn't happen that way. So the government has this SAGE program. NIMHANS came up with an online psychology. There's some few examples that some people are trying to respond to. Right now, there is a particular program on startups in digital health. We are the go-to market partners for that. But the idea that you have to design for elderly is very important. You have to be oriented towards their needs, their requirements, and therefore the solutions. And the third point is around the research and data for elderly. This is a segment that doesn't get much research done. Nobody looks at a 60+ data. Most studies stop at 60 and nobody considers. So I just thought about putting some illustrative examples. For example, Ayushman Bharat is very age inclusive, but it would be interesting for the government and for the participants to know that what is the percentage of 60+ that are registered under Ayushman Bharat. They face the highest risk of hospitalization. Vaccine registration became a big issue initially, but do we know, for example, what percentage of 60+ access themselves or they were registered by somebody else? The percentage of people who are accessing telemedicine. So the whole industry, NGO, academia, partnership for research can be a very, very powerful field. LASI is a recent study that has been done. Dr. Ipsito's institute is doing some work, but this is something that is possibly needs to multiply manyfold for us to come up with new insights and evidence to solve problems. So at the end, I would just like to say the key is collaboration. And I think we need to all work together to not just develop technologies, but ensure adoption of technology, use of technology, and digital health has great potential if adopted and used and embedded in the for the senior citizens to benefit from. With that, thank you very much. We look forward to partnering.
Dr. Prasad, I think that was an excellent talk. And I think there were some very, very, very important points that you talked about digital inclusion, about the challenges that people face. In fact, I must say that I took a few snapshots of your slides because I found them very informative for everything. It's the technology, and as a doctor, I can tell you that overnight, when COVID started, overnight, everybody just became comfortable with technology. Overnight, it was something phenomenal. 24th of March 2020, I think, was lockdown. And 21st, nobody had any clue what's going on. And on 22nd March, I was suddenly had a tele-OPD center. My assistant was hooking up my patients with WhatsApp who were sitting in remote parts of the country. And he was like, Dr. Gupta, this person is having this problem, this person is having that problem. And I was sitting in the hospital doing these teleconsultations, something which was not really, I had dreamed of even 1 week before. Even 1 week before somebody had told me that I will be doing this, I would have this thing. But overnight, and I think it has really fast forwarded our technology adoption. And a lot of us, and including senior citizens, they've also overnight suddenly, and I think the technology just became a savior for them.
Absolutely.
Because all the elderly people were sitting at home, they were, they did not know what to do, how to connect. They were physically distanced, but socially they wanted to feel connected. Now we talk about social distancing; it should be more of physical distancing and social connection. So. So I think that was something which happened overnight. Like you raised, I think you hit the nail on the head as to where we are and where we need to be. Dr. Chakravarti, if you have any points, or Mr. Siegel.
Dr. Chakravarti, would you like to say something?
I was just wondering, due to paucity of time, actually due to paucity of time, I couldn't explain that model, DKA intervention model. Actually, Digital Knowledge Accelerator is the name of this digital literacy program I was about to show. It is a recursive model, iterative model, but since time was short, that's why I told you that I will do it later on. But I just want to share the model at least with all participants, with all audience. Is it possible anyway? Because I don't want to keep it with myself only. I want to share. There's no question of copyright, nothing, but this for the well-being of all. We have to get together, synergistic action. Is it possible to share this maybe after the closure?
Sure, we can. So if you share it with us, we have the details of all our participants, and we can definitely, circulate and share it with them. And of course, also with our fellow panelists.
Sure. I'll be grateful for that. Thank you very much.
Right. I think I have, Dr. Samir, if you permit, a couple of things to, let's say, check with Dr. Prasad, Rohit Prasad on. One is, I think one of the biggest gaps which I see, I mean, of course, all of us have aging parents back at home. And one of the biggest gaps which I see is in terms of access for any elderly healthcare is the communication, is reaching out to them, with what all are they eligible for, what all can they really access, and at what points. Now, are there any specific initiatives which you or any other NGO is taking on that front, or for that matter, is the government taking any such initiatives? And what are the key steps to really, take that forward? Because I think that's very, very important. Today you see a lot of television ads which talk about, children who are blind, please donate for this purpose, or, infants dying, UNICEF program. But I really don't see too much of visibility for, aging population to really be able to, even this 1, 4, 5, 6, 7 number, it's not highly publicized. So where do you see it going, and especially with this aging population having limited access to technology, it's a bigger problem for them.
Yes.
So I'd like you to comment and also share some thoughts of how to take it forward. Where do we collaborate to take it forward, and how do we go ahead with it?
Yeah. No, thank you, Mr. Vivek. I think that's a very, very important question. Essentially, if you look at it from a more fundamental point, that there's not enough attention being given to this particular area. And it's not because we don't want to, because in a country which is very youth dominated, a lot of the areas from a health perspective, it was always the the early child, the adolescent, and these are very important areas to cover. At the same time, how do you direct not only your attention but also your resources towards this particular area? Now, take the example of some of the recent initiatives that the Ministry of Social Justice has taken, and we must compliment them because they have for a long time focused on welfare, just delivering benefits and services to the marginalized, the ones who are disadvantaged. But they have in the last few years come up with this particular helpline, and we used to run this helpline for a long time, but we were subscale. 14567 is now present across something like 25 states. We used to get in our own call center in Delhi before we joined the national helpline. We used to get calls in the range of maybe 8 to 10 calls per day. Now we get in hundreds. So there is a change that is happening by virtue of the government taking some initiatives, some of the industry members taking initiatives towards this to make it what I say is mainstreaming. It's not mainstreamed. Because it's not mainstreamed, you don't catch the attention or the resources for this particular sector. So the aspect about how, and this was just one example, but health is another example and a very important example, telemedicine, for example. But there's a third dimension to it, which is maybe interesting for everyone to know. Government has a lot of schemes, what we call as the entitlements and linkages program, but many don't even know about it. So how does one, a person, a 70 plus person in a rural area, he is entitled to some pension. We can forget about the resources side right now, but let's say he's entitled to some pension, but he's not able to go and register himself. But once he registers himself and he starts getting, let's say, 500 rupees every day, every month, that's a very, very important change in his life. So the government in many ways is trying to bring this program to the grassroots level and creating these linkage points like the CSCs and so on. My suggestion on this is threefold. One, of course, and that's why I said, very happy to see PHDCCI taking this initiative to look at the senior citizen as a segment in the context of digital health and so on, but as a segment. How does the members think about keep the senior citizens within their overall CSR mandate? It's not to direct huge resources towards that, but keep that as an area to explore. They will find their own way of linkaging it. So that, for example, it may be a linkages program where many organizations like Haq Darshak, including us, we are trying to see how we connect the schemes to the beneficiaries who are entitled for it. And the whole ecosystem is there, but it needs to be accelerated, moved forward, and so on. The 14567 helpline is something that all of us can pretty much advocate and carry this message across to every household. And the supply, the way of responding is very much there, but many may not be aware. And it's not just the information. Sometimes they're abused, sometimes they don't have recourse to. The Maintenance Act is a very big act, which is like the last resort from a legal perspective. Again, the awareness. So the awareness, the engagement from all sections of the society is core to making some of these, what you call as the disconnects, converting to connects. And I think that is something that we will all need to work together on.
Mr. Vivek, you're muted.
Okay. Thank you. I'm sorry I didn't unmute myself. Thank you for those inputs, Shri Rohit. I think it brings me to a point which our Secretary General mentioned before we started the discussion, was the access to healthcare per se. Now I'm not talking about digital per se, but access to healthcare for the aging population, where they do not have resources, where they're constrained on the financial front or maybe other fronts as well. So where does HelpAge or any other NGO today fit in, and what are the initiatives there And are there any government initiatives or lack of initiatives where we can work together? I'd like to have a quick view on that from your side, please.
Sure. No, thank you. Many NGOs and, as we say, the senior segment or the senior citizens carry a disproportionate burden on health because of various reasons. Partly it is because of age, and the comorbidities is increasingly a topic that has been discussed in the papers in context of the vaccination. So about 70% of the senior citizens have some kind of comorbidity, and therefore their care is required. So a lot of the NGOs like us also, we run about 160 mobile health vans across the country, and the basic aim is to reach the unreached. And it's only to supplement the health system. If the health system was completely there, we won't need to be there. So it's only to augment and supplement or fill some of the gaps that may be existing. We work with the CSR, the corporates on some of their locations that they may be present. Some of them are more closer to plants, but also broadly. But that doesn't solve the problem. So 150 mobile health units, I'm able to reach something like 5 lakh population. But that's a very small part, and there may be many others who may be trying to do this. Ultimately, there's a program called National Program for Healthcare of the Elderly. This was launched in 2010 by the government. It is focused on geriatric care at both at the district level, at the sub-center level, PHC level, district level, and at the super center level at the cities. So the initiatives by the government have been well thought of. The implementation is something that needs to be accelerated. So it's currently maybe in 200 districts. It needs to be in the 700 districts if you want to build that capacity at that level. The response on the ground in some of the ways, the telemedicine and the telehealth may be transformational. So just imagine somebody who's sitting in the urban location, as an example, but having let's say a mental health, or would like to just be counseled. Forget about psychiatric. I'm just thinking about a basic counseling session. Where does he go? So the helpline is one option, but the NIMHANS example is another interesting example where you have psychosocial support through teleconsultation. In the rural areas, this is something that is, the health system is obviously, from a senior citizen perspective, is lacking. So we try to initiate new ideas. For example, we said, can there be a Gram Chikitsa, a rural clinic? So in one day, somebody from the city, is setting up this particular clinic. So we have done these experiments, if you may, called elder self-help groups, because the elders are marginalized in rural areas. So we brought them together, then they try and do this, and this is now being taken up by the government to scale up. But these are models that I think the industry and many of your participants also can be aware of. We'll be happy to share some of the interesting innovations that are happening, but these need to be scaled up. And of course, the ultimate solution is in government coming forward and making some of the schemes operational. So we have submitted it to the government this time as well, particularly in context of the COVID, that NPHC must be accelerated. So we can share our budget note also with you, and then increasingly you can. I think if the voice of the industry is added to it, then obviously it will make a difference.
Sure. Thank you. Thank you, Rohit. Dr. Sameer, I think you've taken the session very actively forward. So give me a chance to have your comments on it, and how do you see things going forward in light of the discussions from Niti Aayog, or whether it was the research point of view, or from NGO like HelpAge. And of course, you also sitting so passionately behind all this senior care, with all the experience from US, and of course, implementing it on ground. So I'd like to hear from you, your final comments. And maybe I would like to request after that our Secretary General to give the concluding and the vote of thanks.
Vivek, I think this was definitely a lot of learning from, I think, all the different speakers, whether it was Niti Aayog talking about how they're thinking about 2030, whether it was Dr. Chakravarti who was talking about, about the use of technology and how technology can be started, and the types of aging in the elderly, and of course Dr. Prasad and Mr. Prasad very nicely summarized everything and gave his the Health Age India outlook towards it. I think we all agree that digital is the way forward. Whether it is, and I think the government is also recognizing that with the digital health mission that they've launched, and with the Aadhaar card, and with technology, the cost of everything becoming cheaper. Technology is the way forward. I'll give you a small example. I get patients, when we think of medical tourism, if you think of medical tourism in two parts. Everybody thinks that there are patients from outside of India who are coming. Yes, that is definitely medical tourism, right? When you've got patients from Afghanistan, you've got patients from the Middle East, you've got patients from Southeast Asia who are coming to India for healthcare. There is also the important medical tourism, which is local medical tourism, where people are coming to you from different states. When they're taking a train, when they're taking public transportation, I think 50% of my patients whom I see in practice are people who are not residents of Delhi NCR. They've traveled from far and away, who are coming for healthcare, and they're coming for the best healthcare to Delhi NCR. That is also medical tourism. Now you write these people a medicine, right? You give them medication, and you say, what, I want you to take an aspirin, or I want you to take a cholesterol medicine. And the next question they ask is, doctor, I live in a village. This village is, it's taken me 18 hours to come here. I had to change 2 buses, and I took a train. And that's how I've reached here. And this is in private practice. I'm not talking about a government institution. I'm talking about in private practice. It's taken me, will I get this medicine over there? And these are older, as a cardiologist, by default, majority of my patients are older age group. And now I very clearly tell them that it's available online. The other day I was reading something that Flipkart is there in 95% of pin codes in India. They're delivering in 95% of pin codes in India. So this is digital, right? It's to the last man, to the last mile delivery is now becoming feasible and possible. And the same thing translates into healthcare. And I think healthcare, as you age, what are the 2-3 things you require? You require financial security, you require health, and you require social support, right? How can I take care of all these 3 things as you age? And that is where digital comes into the picture. You're able to make financial transactions. In our assisted living facility, in our senior residences in Gurgaon, there are still people who are not comfortable with online banking and online statements. So, and when I say a few, I would say majority of them. So so we have someone over there who goes and does the odd jobs that you want. For example, you break your spectacles. Somebody has to go and get the spectacles repaired. If you're staying at home by yourself, it's a day, it's half a day for you, right? Because you'll call an Uber, you'll call a cab, you'll take the cab, you'll go, you'll get your spectacles repaired, then you'll come back, then you will go pick it up and come back. So it's it's 2 trips to the shop for you. Over here we have someone. So what I'm trying to say is, and now this person, we ended up realizing that he goes to a bank for about 4 to 6 hours a day. So it's 4 to 6 hours a week, where all the residents want the passbooks updated. And I said, who uses passbooks nowadays? Just go and bring your online statement. But they're like, nahi sir, ye 80 saal ke hain, inko passbook bharwani hai apni. Unko wo aadat hai. So they are not attuned with technology. Otherwise, they would just get online, you press a button and your bank statement comes out, right? That's the simple way of doing it. And that's what majority of us are doing it. But these people want the passbook updated. So this is a small little thing, example I'm giving you. Now, this is, and this thing is amplified every day as we live and as we are dealing with these older people. There are so many older people who stay with us. And these are people who are coming from, affluent families and who are educated, who've got children maybe abroad, maybe in the same city. So that is where we see the divide in technology as to how, वो कहते हैं ना कि अगर आपने कुछ अब पढ़ा नहीं तो आप पीछे रह गए. And वो एक बारी वो that person falls behind, he just keeps falling behind. It becomes a spiral thing. easier said than done. Maybe one day when I will age, as I'm aging every day, everybody's aging every day. I hope I don't get left behind and my son doesn't tell me, Dad, you don't know X, Y, and Z things. But that is where the technology divide comes in, right?
Yes.
And that is normal. This technology divide is normal. The question is, how do we make sure that the percentage of people who are getting left behind is the least? Right? There will always be somebody who will be left behind, but how do we keep that divide the least? And I think that is where the challenge comes in. And I think with some of these important points that were raised today, that keep the elder people involved in the technology when you're designing those technology solutions for them. When you're taking those classes for them, so that they don't get left behind, keeping them educated so they don't get left behind. And these are some of the very important points that we all talked about. I think we all are in agreement that these are all, that this is the need of the hour. Senior care is first of all the need of the hour, and making sure that all aspects of their life, whether it is social, whether it is financial, whether it is health, are taken care of. And the core of all this at some point becomes digital. So I think this was a very good discussion, and thank you for organizing this to the PHDCCI.
Thank you, Dr. Sameer.
So Vivek, if you don't mind, can I make a short point?
Sure, please.
No, I just, the Secretary General had earlier mentioned a very important point, which is often overlooked, which is the 60 plus population. And Dr. Sameer, you also mentioned how 0 to 5, 5 to 10, the children you segment, but the elderly, we tend to see it as one homogeneous group. But in the 14 crore 60 plus population, 60% are in the range of 60 to 70 years old. And they're the balance 40% in the 70 plus. So you can imagine that the 60 to 70, you are just extending the life, it continues as is almost, it doesn't change. But beyond 70, suddenly it changes, significant way. Yes. And beyond 80, it's a very, very significant shift. So one of the things that Dr. Madan Gopal also mentioned, and the Secretary General also mentioned, that healthcare for 80 plus, and it's not only about the disadvantaged section, I'm also talking about more like a senior care, the health, for the seniors. And we made a representation to the government this time that all 80 plus should be included in the Ayushman Bharat, because when they need it most, they have it the least. And what the other social implication of that is a very important implication. The families who are already maybe economically challenged, then they tend to push the 80 plus out of their homes because they feel that the economic burden is too high. And therefore, even the social obligation, they put it aside. And so by virtue of putting the 80 plus in that category, not only you will take care of them, there may be extra funds involved, but you will create a acceptance for the family also to allow that care to continue and they live within the family. So a lot of these are very interconnected issues. They're not, and I'm glad that the Secretary General mentioned about this point. Thanks.
Right. Thank you so much for clarifying that and laying stress on something like that. And we'd be too glad to have this, representation which you've shared with the government and for the budget. And we will definitely discuss it internally and also push it across through our quarters. With this, I think so much of knowledge flowing through the evening and a lot of thought sharing, I think, which has happened. I definitely look forward to some concrete things happening going forward. And I cannot help but request our Secretary General, who has been gracious enough to be part of these discussions throughout, to conclude with his thoughts, because he did initiate some thoughts at the start of the discussion and also propose the hearty vote of thanks. Over to you, sir.
Thank you, Vivek. Good afternoon, gentlemen, senior doctors and specialists from your respective fields. I think this discussion was very, very fruitful, especially for me. The detailed presentation made by Sri Rohit Prasad and Dr. Ipshito Chakraborty was absolutely mind-blowing. And a large number of facts have come to our mind which we were not really aware, let me tell you. And the fact is that Dr. Sameer brought out very, very relevant points. If we consider, India has been shining now under the Modi government. From the 33% BPL population, we have come down to 21%. And if we consider the senior citizen in that, which is likely to be non-tech savvy, so it will come down to, if we do the calculations, I was just checking it, it will come down to less than 1 crore. Out of the 135 crore population, it will come down to less than 1 crore. So it is not a very difficult task to skill them. Like, this is another area of opportunity for a chamber to come out with the process of skilling the very senior citizens, which is 75 or 80 plus. And this will be a unique opportunity, a business opportunity, I would say, where the government is going to certainly support with plenty of grants, as also the startups who are tech savvy. They'll be very, very well engaged and organized in providing this support, because they are the future generations, these startups, the tech startups especially. NASSCOM can be, one of the potential nodal of organizations which can take up this matter. And we'll certainly, Vivek ji, you can take down that we can certainly make a representation to the government that the skilling of the very senior citizens is dire necessity now. It is not only a it's not only a requirement, but it's a necessity to provide all types of services, including healthcare. Healthcare being the most important in that age group. So I would like to thank each one of you for contributing and giving detailed presentations on this. And especially, I would like to thank Aurum Senior Living, who's our annual health partner, and then Calcutta Metropolitan Institute of Gerontology, and APJ Satya University, who have been our academic partners for supporting this webinar. And I would like to congratulate my team led by Vivek Sehgal and Dr. Ravi Rathore and his entire team for putting across such an important webinar, which is certainly overlooked in the past so many years. And even today, the government is not taking it seriously. So there is a point to ponder, and there is a requirement to take up this very, very seriously with the government of India as well as with the state governments, because the land, labor, and such kind of initiatives can only be taken by states and not by the center. The center can only lay guidelines, but it is the states which have to drive this initiative. So with these words, I once again thank you. I'm sorry that I came late, but it was a very interesting topic and I'd made up my mind to join it. But unfortunately, because of the meeting which got extended, which generally is with the Honorable Piyush Goel ji, it gets extended many a times. So today also it got extended. So thank you so much once again for sparing a valuable time and coming here and making such good deliberations. Thank you. And Jai Hind.
Thank you.
Thank you
so much.
Thank you, esteemed panelists, as well as the delegates. Thank you, Ravi and team.
Thank you, sir.
PhD for organizing.
Excellent webinar. Very good webinar.
Thank you, sir.
And I would thank Vivek, because he is under COVID. His entire household is down with COVID. But yet he is here performing and he is holding these webinars. Thank you so much, Vivek.
Get well, Vivek ji. Thank you.
Thank you, SG. Thank you.
Thank you.